Habari, my name is Stella Mujaya, currently a health consultant. When I joined this leadership journey, I was serving as a country director for the Data5 project in Tanzania. My leadership project intends to contribute to the knowledge that will help empower council managers to take leadership in data review and decision-making. Let me start by acquainting you with the roles of these council managers in Tanzania. First, they manage health facilities. That is, they coordinate allocations, distribution, and utilization of resources. They also provide technical and professional expertise on improving quality of health services at the council levels. So with these few to mention responsibilities, you would agree with me. It is imperative that they have the essential technical and soft skills that will help them better analyze, interpret, and apply data to solve problems. It is also important that they realize the importance of regular review of data. Currently, if you look at the council annual health, are budgeted to happen on a quarterly basis. So certainly this culture won't help solve problems immediately. My leadership project is based off from the Data5 project scope that was implemented in 9 councils of Tanzania. So in these slides, I will mention what the Data5 project did and what my project intends to accomplish. At a very high level, Data5 project, in collaboration with the national and council teams, managed to establish routine data review meetings with the aim of improving program performance. They also supported establishment of situation rooms and capacitated council teams in the area of analytics and quality improvement methods to help them drive actions. With the sustainability thinking during the 3rd year of implementation, the Data5 project worked with council teams, identified managers who will take on leadership role of leading these regular data review meetings without the presence of the Data5 project staff. And with that, a total of 27 managers, 3 in each supported councils, were identified. Then we learned that the Data5 project will not be receiving funds in the 4th year. So I thought to myself, we will be transitioning leadership of regular data review meetings to these council managers, which is great, sustainable. But since we are closing, follow-up and monitoring piece is missing. With that, I decided to focus on that piece, using an online assessment, which I launched to these selected managers 4-month post-transition period. I wanted to get information on a couple of things, such as, will they continue the momentum of meeting weekly without the presence of the project? Are there challenges that they've been experiencing or achievements that they've been able to document post-transition? Is the application of gender lens taken into consideration as they are facilitating data-driven decision-making discussions? And last, since the Data5 project was closing, I wanted to take this opportunity, identify stakeholders who may potentially tap into this investment and also who may utilize findings of this assessment to come up with tailored interventions to these council managers. In the next 2 slides, I will share key findings of the assessments. 1, did they continue to meet without the presence of the project? A positive momentum is reported here. Though only 1 council was able to attain the target, you can see here majority are not very far from the target. Did each manager get a chance to facilitate? 74% of the managers reported to have met or exceeded the target, though when you look at the numbers, male numbers are lower than female numbers. Challenges experienced in facilitating these meetings. It is striking to see when it comes to health information system, more female managers report to have struggled navigating through health information systems, while the struggle for male managers is more on technical knowledge of the indicators that are being reviewed at that particular time. This is also the same with translation of data. While use of some of the quality improvement tools to drive action has been mentioned to be a challenge, health information system is also coming up again. And here we see, interestingly, the challenge is only seen in female council managers. 26% of the council managers reported to have received gender training or any awareness program related to gender. We also ask whether they ask specific questions to assess gender impact. Almost half of them reported to do so. But when it comes to data analysis, whether they look for gender-related patterns, trends, or disparities, you see the green decreases and the red increases, which means fewer seem to do so. Same also with the data visualization techniques. Do they highlight gender-specific insight or disparities? Even more, fewer seem to do so. So I think this is an area stakeholders may wish to consider investing because it is going to help these decision makers make more informed choices that addresses the needs and concerns of all genders. Oh, this has been a transformative experience as I have been able to embody all the pillars of the WomenLift Health leadership journey. My project not only cultivated a culture of inclusivity, but it also recognizes the importance of building allies. The journey has also honed my strategic thinking ability and helped me leverage my power, just being able to get the best out of the situation and the best out of the people. I wish to take this opportunity to call upon stakeholders working in this space to capitalize on these findings. And second, to continue reinforcing the culture of regular data review, because this assessment shows that it is possible without even partner support. Last, I wish to thank the WomenLift Health for this opportunity and to thank my fellow cohort members as I have learned a lot from you. Thank you all for listening.